Should you go see a specialist? Part 1. In today's episode, we're talking about bladder issues and urinary issues and whether you should go see a specialist about these issues. And we're going to do it in a couple parts. So part 1, let's say you are leaking. Let's say you're leaking urine and it's just one drop of urine. And it doesn't really bother you, and you can wear a panty liner, and the smell isn't overwhelming. Do you need a full course of pelvic floor physical therapy? Probably not. But I think you should consult with a pelvic floor physical therapist to learn how to prevent this from getting worse. Maybe you just need a few tips on how to find your pelvic floor muscles, how to strengthen them, how to connect with them. Maybe learn some devices that are out there and see if they're right for you, or just some resources that you can access. And sometimes just a consultation with the pelvic floor physical therapist can do that. So if you can't get to a pelvic floor physical therapist, you can always do a telehealth video consultation. We can give you information that you need. You can also check out my channel, or you can Google some resources as well. But I think it's always a good idea to consult with the pelvic floor PT, at least for one session. Number 2, let's say you're peeing at night. Well, that's called nocturia or nocturia. And if you are getting up one time a night to use the bathroom, it's okay if you are older. Let's say if you're older than 65. But if you're younger than that, you should be able to sleep through the night. The job of your bladder is to store urine. So getting up in the middle of the night, maybe it's just because of what you're drinking or when you're drinking, when you're eating, and maybe this is just triggering your bladder to wake you up, and then you're responding behaviorally to that, and you're getting up in the middle of the night to go to the bathroom. So we want to prevent that, right? You want a full night's rest so that the next day is productive and you feel rested. So sometimes it's just consulting with a pelvic floor physical therapist about fluid intake and maybe just connecting again with your pelvic floor muscles and how to strengthen them, how to relax them. And you don't really need a full course of pelvic floor physical therapy, but a consultation can help. A lot of times it's just a little bit of behavioral modification, developing new habits, trying to kick old habits, like drinking really late or drinking maybe that glass of wine a little too close to bedtime. Maybe that dehydrates you and, makes you feel like you want to get up and drink some water in the middle of the night. So just consulting with a pelvic floor physical therapist may help. Part 3, let's say you're going to the bathroom more than 5 to 7 times a day. That is called urinary frequency. And again, that could just be what you're drinking and when you're drinking it. Maybe you're drinking a lot of carbonated drinks or caffeinated drinks. Like maybe you just love coffee a little too much. Maybe it's just a few tips that you need and resources that can help you with relaxing your pelvic floor, relaxing your bladder, and just changing some habits. Maybe you don't need a full course of pelvic floor physical therapy, but consulting with a pelvic floor physical therapist can always help. So that's my answer. I think that at least talking to a pelvic floor PT is a good idea. You probably don't need a whole course of 8 sessions, but just consulting is always helpful. Subscribe and follow for more.